about what is entrepreneurship and how does entrepreneurship actually work. What is it that entrepreneurs actually do? Well, we tend to think of entrepreneurs as having this one great idea. And they just imagine this wonderful thing, and if they have this great idea, nothing can beat them. Right? Then they just do it, and that's it. So very often, beginner entrepreneurs, amateur entrepreneurs, they try to figure out the idea, and they try to save the idea, protect it from all competition. So very often, my students will say that, I have this idea. Can I tell you? Because they don't want anybody else to have the idea, because then someone else might steal the idea. Well, the idea doesn't actually matter. The idea does not matter. And why is that? Because it's the implementation that matters. Very often, a first mover is the first loser. Right? The second mover learns from the first mover and learns to avoid the mistakes that the first mover makes. So it's not the idea itself, it's about how you do it. It's how you position yourself with respect to the competition. It's how you communicate the idea and the product to the consumer. And it's how you organize your business internally. So in the literature, we distinguish between invention and the innovation. Invention is the idea. You need an idea. So it's not completely worthless. The innovation is how you bring it to market. So it's how you produce actual value to your customers. Very often, you can do this with an old idea. Right? So you have many companies that made a killing because they took an idea of someone else that was already in the marketplace, but they presented it in a different manner. They did it in a different way. And that's the real entrepreneurship. That's how you create value. Right? Maybe they targeted a different type of customer. Maybe they presented it in a different way. Maybe they priced it differently. Such a small difference as paying upfront for the product or subscribing to it. Some of you might have heard of Spotify. Right? It's different from buying CDs. If even CDs exist anymore, I don't know. I can't recall. Right? It's very different. It's still music, but that doesn't matter. For the customer, it's different. Because suddenly you have access to the whole world's music at a small charge every month instead of buying a CD and then you're stuck with those 12 songs. Those are very different things. You're still selling music. Right? So it's how you bring it to the customer that matters. So invention doesn't matter a whole lot. It's the innovation that matters. So the true magic is in how you do it. It's not the idea. Okay? So remember that first. What is it that entrepreneurs actually do? They create economic value. Economics sounds like money. Or maybe even Wall Street. That's not it. Economic value is satisfying a want. It's just making people better off in some manner. Okay? Very often we do this through exchange using money. But being better off, feeling better about yourself, being healthier, all those things, that's not really a monetary thing. Right? The satisfaction you feel when you get an awesome service from some company is different from the actual product. Am I right? Those are different things. The economic value is the satisfaction you get. It's how you feel better off after you've consumed something, after you bought something. That's why when you buy a BMW, the commercials, the advertising, is not really directed to you who are going to buy or can buy a BMW. It's directed to you who bought a BMW. Now, why the heck would they do that? Why would they invest millions of dollars talking to you who already spent your money? Because they want you to be satisfied. They want to repeat the message, and they want you to remember the feeling when you got your first BMW. That was so fantastic. And finally, I have a Beamer. Right? Everybody looks at me and they go, "Oh, there's the guy with the Beamer." Whatever. But see, it's not about the car itself. It's not about a means of transportation. It's about the satisfaction of having that wonderful car. That's the value they're selling. That's why they're advertising to people who already bought the car. Then others might buy the car or aim to buy the car because they see, "Ooh, I want that kind of life." They're selling an idea. They're selling that type of satisfaction that's purely in your mind. It's very different, right? So the value is purely in your customer's mind. It has nothing to do really about the product. It has nothing to do with the service. It has nothing to do with any of the physical matter. It has to do with how you satisfy them on their terms. So we say that value is subjective because it is the satisfaction in that person's own mind. That's what you have to speak to when you sell something. That's a problem that entrepreneurs face every day because they think of the product. They have imagined how they would use the product. They have to figure out how the customer will use the product. Very often, an innovative entrepreneur who has this new type of product is surprised that people use the product in a very different way. So they sell something they think is something very cool, a technology, but the customers tend to use it as a very beautiful paperweight. Okay, well then the value of the product they're selling is the value of the paperweight, not the technology. Right? And you have to know this, you have to understand this in order to be successful as an entrepreneur. How is it that your customer identifies what you're selling? How are they going to use it? How are they going to value it? It's very different from simply producing a product or a service in your case. Okay? So entrepreneurship is really about satisfying people in general, and especially your customer. It's about creating the means for them to lead a better life. So I usually say that entrepreneurs are in the business of creating a better tomorrow. That sounds a little vague, maybe. Right? But it's true. That's what entrepreneurs do. And they compete with each other, and the consumers choose who are going to be successful because they present these ideas, these imagined futures, these imagined lives, and consumers simply go, nope, yeah, okay. Right? The consumer is sovereign. And consumers don't give a damn about it. I mean, to be frank. They just pick whatever they feel is best in the moment. Or maybe they had a plan and they saved for a while. But whatever, they're buying from one. If someone else presents something better, buy. Some of you might remember Nokia phones. They still exist, but not in most of our minds. Right? They were world leading in cell phones, right? Flip phones and those small little things. Where are they now? Because customers are not loyal. They didn't give a damn as soon as there was a smartphone. They were like, flip phones, who wants that? Right? Some of you might remember your old flip phone. I had a beautiful one, little Samsung, like this big, with a 1-inch screen in color. Well, you can't sell that today. No one wants to text and hit 7 4 times to write an S. Just the letter S. No one wants to do that, right? So they're not loyal. They don't care about you. They care about what you're offering, right? And as long as you offer them something that makes them feel better off, that satisfies their want in some way, they will stick with you until someone else presents them with a better option. Okay? And that's important to realize because if you're offering exactly the same as everybody else, you're just competing on price. And if you're competing on price, you're losing. That's the worst thing you can do as an entrepreneur. Just compete on price. Now, healthcare is a little different because nobody knows what the freaking price is. But still, you should compete on the experience, the value. Okay? So this is how I usually present it. The value must be higher than the price, which must be higher than the cost. That's how you profit from this. The problem of this, of course, is production starts with the cost. You put a sticker price on it, typically, and then you sell it. The reason you can sell it is because the customer values the good higher than they value the money they're giving up. That's the only reason why they would buy it. And you would sell it if you can keep the costs lower than the price. The problem is we think of entrepreneurship in this way. We start with the cost, then the price, then the value. That's exactly the wrong thing to do. You do it the other way around. What did we do this past few minutes? We talked about the value. That's where you start. right? What is the value you're actually contributing to the customer? Start there. Then, what do you think a customer is willing to pay for this service? How much can you charge for this service so that they think, ooh, that's a bargain. That's a good deal. I don't mind paying that. Then selling is easy. Then your job is really to keep the cost under that price. Note the difference. It's not about, ooh, I want to produce this product. How much does it cost? Then I'll add some margin to it. And then that's the price. Let's see if someone wants to pay that. Because that's doing it for you. That's not considering the customer at all. What you should do is consider the value. Let the value determine the price. Okay? So another way of putting this is, of course, your profit is if you manage to keep the production costs, which in your case would be facilities and labor and all this stuff, if you can keep the cost below the price. But you have to offer a profit to the customer too, to the patient. It's the psychic profit. Right? They get this value, this treatment or this cure or just a friendly face or whatever they're looking for. All of them, perhaps. And they profit from it because they value that a whole lot more than the money they're giving up to you. Okay? So there are two parties that need to profit in every transaction for it to be a good transaction. You need to keep the cost below the price, but the price is determined by the customer, ultimately. And the customer needs to value what they're getting higher than the price. If both profit, we're in good shape. Okay? There are no contradictions here, right? Everybody wins. Except for the loser who doesn't realize this. Okay? So what is it that you are selling then as physicians, doctors, whatever? Is it your expertise? That's part of it, right? Is it a treatment or a therapy? That could be it too. Is it imaging? Is it a reduction of symptoms? Is it perhaps a cure of the disease? What is it you're selling? Well, the answer is not this stuff. But the answer is also, yeah, all of this. Right? Because those are components of what you're selling, what you're offering. But it's not actually how you should think about it. Those are just necessary means to give the customer, the patient, what they need. Okay? Yes, you will rely on your expertise. Yes, it might involve a treatment or a therapy. Yes, you might get rid of some symptoms. Well, you should, I hope. You might cure the disease. Those are good things. That's not all of it. Right? Nobody wants to go to a physician who's a jerk but cures the disease. They would rather pick someone else who's friendly, supportive, and sort of treats the disease. That's a crazy priority, isn't it? Why would you prioritize getting rid of some of the symptoms but keep the disease, but a friendly face, instead of a jerk who cures you? Because it's the whole experience, right? So what you're selling is the value experience as the consumer understands it, as the patient sees it. So if the symptoms don't bother them and you tell them they're sick, what are you selling? You have to communicate to them. You have to tell them how they are sick and how that is not a good thing and how that might have complications later on or whatever. All of those things. But it's about the communication, right? You have to show to them what it is that you're offering and why it should matter to them. Not just say, there's a virus. Well, if it has no effect on you, then why would you care about a virus? Unless you can scare them, of course. That this is a virus that will kill you. Then maybe you have a case. But if you can sell the whole experience, if you can show that this is a broader thing, and from your point of view, you should value what I'm offering because what I'm offering is this better tomorrow, right? A healthy one, one where you don't transmit the disease to someone else, whatever it is that the consumer might actually value. Okay? So That makes this really hard. That makes entrepreneurship difficult because you have to figure out what is in people's minds. It's really hard to read people's minds. I mean, how many of you are married? It's not easy. And if you can't read the mind of your spouse, how the heck are you going to read the minds of thousands of people you never met before? That's not going to happen. Right? But you can guess, and you can use your experience, and you can talk to them. You can try to communicate what you have to offer and make it valuable to them. But it also means that you should probably narrow it down a little bit. You should find your market segment and not say, I'll treat anyone and I'll offer exactly this to everyone. Everyone is not interested in that. And the sad thing is, if you cater to all, you cater to none. Because there is no one size fits all. People are not interested in the same things. Right? So, another thing to think about is the business model, is how you actually do it. One example of this that I love, and there's modern, because as professors we tend to look to old examples, and we'll get to an old example in a bit. Volvo, the car company. What do they sell? Safety or safe cars, right? And they sell it like everybody sells cars. They say, give us, I don't know how much a Volvo is, $30,000, and here's a Volvo. Bye. Right? Well, they have this idea that maybe they shouldn't sell cars. Which sounds crazy, right? Because that's what they do. Instead, they're going to sell subscriptions. It's going to be a subscription service. They're going to offer you a Volvo, and you pay a monthly fee. It's not leasing, because it gives you access to the car, and you can, well, whatever. The exact details don't really matter, but they're going to stop selling cars. Because apparently they think that the cars are so safe and so good, the quality is so high, that they can just do it a month-to-month sort of contract. Okay? That seems crazy, but when you think about it, what they're actually doing is just a different business model, the same kind of physical product, but just by tweaking it is different. And what I think they have in mind is what you're doing is subscribing to a vehicle, not that vehicle. Right? So what they're doing is saying that, as long as you're home and you subscribe to, say, one SUV, you drive your car, and then you go somewhere else, and instead of renting a car, you have the subscription to one car. So you just pick up the same type of car, and then you're on your way. Of course, with self-driving, that means that you're riding at home in your SUV. Your SUV takes you to the airport. You get on the plane. You pass security and all the stuff first. You get on the plane, and you're picked up by the same type of car because you subscribe to one car. Now, that's a very different thing than owning a Volvo. It's the same damn car. See the difference? It's just how you provide it. Suddenly, it's not the thing, but it's the service. It's the experience. It's having this means of transportation available wherever you go. You have one, or you can get one for each family member, or whatever. They reconceptualized, reimagined what it is they're selling, which is core to entrepreneurship. That's the innovation, right? And you can probably see that, whoa, wait a minute. If they're already doing this, aren't they going to kick their competitors' butts? I mean, with self-driving cars, and people go, either buy one for tens of thousands of dollars, or it's like $400 a month or whatever it is. And I can always have a new one wherever I go. Which would you choose? Well, they have the upper hand suddenly, because they dared to innovate beyond the actual product. Okay? So, the importance here, and this is the older example, right? This guy is gone. The point is that you have to reimagine what you're doing. You have to imagine something new. And you can't really just ask people. If you ask your customers, they'll probably say, I want to get healthy. or I want to lead a long and healthy life. Okay, well, maybe there's something else. I'm not sure what that would be, but in the case of Henry Ford, he thought of his customers, and he realized that they might want something that they don't have and that they don't understand. They don't know yet, because customers, they're lazy suckers. They just basically sit back and they wait for entrepreneurs to produce something and present it to them, and then they go, nah. And there you are. You invested time and effort and lots of money for 10 years developing this product, and customers go, Or they go, wow, I never thought of this before. And that's what Henry Ford realized, because this quote, which I'm told is something he never actually said, but it still kicks ass. So the thing is, had he asked people what they wanted, they would have said faster horses, because they were used to transportation by horses. Well, he said, it's better to have transportation without horses. And I think people will like that a whole lot more. Now, maybe we could have mechanical horses that were really, really super fast today. That wouldn't really beat the cars that we have, I think. Right? So he said, there's something else that people want, and I think I know what it is. Let's do this. Okay? And there are modern examples of this too. Here's Steve Jobs. He's also gone, but he's much more modern, saying that, well, when you develop new technology and new items for people, you can't really have a focus group. You can't really sit some potential customers down and ask them, hey, what is the next big thing you want? What kind of technology do you want in your pocket? No one knows that, right? Instead, what you do is you imagine what would make their lives better, then you put that idea into practice and produce the thing, and you sell it as an idea. You sell it, not the product itself, but you sell how it will make your life better. Right? If you remember the first iPhone, as a phone, it really sucked. You could hardly place a phone call on it, but it had internet. Really slow one, but still. Right? They combined all these things and had this promise, and that's why people wanted it. They wanted a whole lot more than the flip phone, because they sold the promise. Okay, so let's get to regulation. So regulations, when we think about them, we usually think about, you see in the middle there, we think about them as the promise that is used to sell them. It's usually about increasing safety or protect people. It's about making sure the quality is high, all this stuff. Well, regulations are really restrictions. They're either outright bans, you can't do this, or they say, if you are to do this, you have to do it this way. Well, if we think about regulations in the right way, what they're actually like, you can see how this would hamper entrepreneurship, let's say. Right? Entrepreneurs imagining this better tomorrow, this new type of life that people might lead, and then someone says, you can't do this, you can't do that, you can't do that either. If you're going to do that, then you have to do it this way. Well, what is left? You want to rethink the whole thing, and there you have regulations that you have to abide by. Of course, that's going to stifle innovation. It's going to make entrepreneurship almost impossible. That means that we will not get these new products, we will not get these new services, we will not get this better tomorrow, because regulations are there. And it doesn't matter how much regulation there is, in a sense, because as long as there is some regulation, entrepreneurs can't go there. Entrepreneurs cannot address that area, which means that area that is regulated is going to be worse than all the other areas, because no one has imagined new things there. So when you have a regulations, since you cannot imagine things, you also cannot start new things. Whoever is already in the business cannot really reshape the business, cannot meet what they think customers will want in the future. But they're also, in a sense, protected from others, right? Because as long as you do what you do, if it's regulated, no one else can really enter. So you have examples of this you might have seen both Amazon and Walmart are big proponents of a $15 minimum wage. Now, why the heck would they want to increase their own costs? Well, it's easy. If they increase the cost of labor, what do you think a new startup, the new Sam Walton, do you think they can cover $15 an hour before they have any customers, before they have any reputation, anything? Of course not. The greater cost is on the new entrant, on the entrepreneur starting something new. Walmart can cover that cost. It's not a big deal for them. They would rather not, perhaps. But the option is someone reimagining grocery stores, retail stores, right? And getting rid of that competition means they can continue doing their thing and continue earning profits. Well, imagine what this means for consumers. Because Walmart will no longer have to reimagine retail. They can continue doing what they're doing. So you're not getting the new Walmart 2.0. You're also not getting the new entrant, the competitor who would do something completely differently. Because they can't enter. Because of this one rule. It increases the cost. Well, for consumers, that means you're losing both sides, right? And we have to recognize this and look at both where we're at. What we're seeing is if they raise the minimum wage to $15, people who still have jobs will earn $15. But we'll also have all these people who can't get jobs anymore. The new types of Walmart, the competitors of Walmart that might not happen, that's the unseen. We're not going to see that. We have to know both parts, or we can't really make a decision on if this is a good regulation or not. And regulations are typically sold by just looking at the seen, but not the unseen. And then I add the unrealized to this because the market process is really cumulative. Entrepreneurs, they take what is and they imagine new ways of doing it. They add to the technology, they add to the service. They realize that, oh, this worked before, so we can do something differently. Well, if you have regulations that mean this doesn't happen, the next step doesn't happen. The step after that doesn't happen. That whole trajectory is gone. That's the unrealized. All those goods and services, all of this fantastic world that would have been, that never came to be at all, because of entrepreneurs being stopped by regulations. So this is my book on that, and I use that in my teaching, which goes through how entrepreneurship shapes the market economy and how regulations impact the economy. It's supposed to be sort of an introduction to a dynamic view of economics. Okay, so what industries are worst in terms of regulations? Well, there are two that I think are pretty obvious. One is the reason we're here, healthcare. Lots of regulations. Why? Usually because quality assurance, protection, all of this stuff. Right? That's why you cannot treat people using your imagination. That's why you cannot start a new clinic doing things in a different way, because no, you have to do it this way. Right? Higher ed is a superb example. Because when I teach, I do the same freaking thing as professors did in the 1400s. Where is the innovation? The innovation is, oh, I can stand in front of the camera and do the same thing, and they can watch it online. That's the same thing. It's just that I'm on the screen. It's 2D instead of 3D. That's not progress. Come on. So what this means is that you haven't seen a whole lot of innovation in these areas. Yeah, you've seen new technologies, new treatments, things like that, right? You've seen new types of courses on university campuses. But you have not seen what could have been. And since these industries have sort of stopped, they're ripe for disruption. It means that someone can come from the side and do something differently, reimagine the whole thing. And none of the incumbents have really tried to reimagine things, because they've done things the way they've always been done. So, this is my last slide, sort of. Here's one example of doing that, right? The taxi cab business was heavily regulated. In many cities, you needed a taxi medallion in order to have a freaking cab. And those medallions were sold at hundreds of thousands of dollars. And without that, you couldn't start a cab. You couldn't drive a cab at all. Okay? Well, if you remember cabs, they're pretty dirty, ugly cars. They didn't show up on time. You had to call for them, and they might not show up at all. They weren't very friendly. Very often, they were pretty rude. Not a very good service, right? Uber could have just said, you know what? Let's do the same thing with buy cars, set up a call center, and have an app. And do the exact same thing, but do it a little cheaper. That's not really reimagining things, right? Instead, what they said was, this space is so regulated. If we are to compete head on with taxi cab companies, we have to do it exactly the same way. So we can cut some costs by having an app and automating some parts of it. So what they did instead was say, screw this. This is not a cab service. This is not a taxi service. Instead, we're just matchmakers. So people can drive their own cars, and people who want to go somewhere, we just match them and set a price. Completely reimagining this and stepping outside of the regulated taxi cab business. Which is why so many cities and regulators freaked out, because suddenly they were like, wait a minute, what is this? This doesn't follow code. This doesn't really fit with our regulations. What are we going to do? So in many places they said, okay, stop. You can't do anything at all. We need to regulate this first. Which tells you what regulators are actually after, right? What they're actually doing. But what happened? Well, customers really liked the idea of cleaner cars, nice drivers, and being able to get a car whenever you like to, seeing the price in advance, things like that. So they picked that anyway. What happened to the old style taxi companies? Many of them just imploded, went out of business. Why? Because they were not reimagining their business. They were not providing value to customers, not nearly the value that they could provide. They were just doing things the way they had always done them, just like in higher ed. And much of healthcare too, where you need the big hospital with all these departments, and there are doctors there, and as a patient you show up, and then you go from one to the next, and then you get a treatment. Well, that's the way things have been done for a very long time. Is there any other way of doing it? Of course there are. Plenty. Just use your imagination and rethink how to do things. So let's listen to one of those superheroes who does things a different way. So I'll call it a case study, if that's okay. All right. Thank you.
I had the advantage of seeing Dr. Bylund's slides early this week. And so I had a fascinating week. I got to apply those slides to my business. And we're going on, Green Imaging will have been around 10 years this December. And so it's been just a really interesting walk down this journey of, looking at regulations, seeing how they apply to my business, and crafting the business around those so that we can best serve our clients. I've put these in as limitations. That's really how I see these regulations. We're subject to the regulations of our industry, and we're subject to the regulations of health plans because we work with health plans. And, the limitations in my industry are typically the Stark laws and the IDTF laws. And when I present to a new client, my sister is frequently on the call, and she says, what Dr. Dickerson meant to say is, and she translates for me. So we have lots of footnotes up here. We have all the acronyms are translated for you. So if I speak over, some of these acronyms, that they are translated up here for you. But the Stark laws are actually put in place to protect us as we, the taxpayers, are paying for Medicare and Medicaid. And, there have been through the years doctors, I didn't used to believe there were bad doctors. There are lots of bad doctors out there. But there are doctors who took advantage of regulations and actually did lease arrangements with imaging centers and profited off Medicare and Medicaid patients. And that's not right. And so these Stark laws were put in place to help fight that. These were, to fight the bad referrals. But actually, if, you read the fine print, radiologists, because we have this unique relationship with imaging centers, are considered consultants. We're not subject to those Stark laws in the same way that referring physicians who are managing these large numbers of patients are. And so that helped me be able to craft green imaging. The other issue here is that IDTFs, that's a classification of a type of imaging center, an independent diagnostic testing facility. Imaging centers in the old days were an office practice for a radiologist, and that's still a classification that Medicare offers us. But, it's almost impossible for one radiologist to really take care of the gamut of imaging these days. And so mostly they're independent diagnostic testing facilities, and they're subject to yet another set of rules that are, again, protective. But they're only applicable if someone is a Medicare provider. So it became very clear to me that, Medicare is the most successful socialized medicine program in the world. Those patients don't need me. The people who need me are the functionally uninsured, are the uninsured, are the people who have high deductible health plans that they can't touch because they've got nothing left to spend on healthcare. And then employers who are spending $1 gazillion for imaging exams that they can, that I can provide them for a third the cost very easily. And then the HIPAA omnibus rule is a rule, and we all see this as this, very onerous duty that we have to take care of protected health information. It costs us a lot of money and time and energy as physicians, but actually it's one of the things that allows me to do what I do. If you look at the HIPAA laws, there's actually a consumer protection issue in here that allows this, and this didn't really happen until 2013, that consumers actually were granted the opportunity not to present. So they could go to a doctor and say, "Hey, I want your cash rate. I don't want you to send this information to my insurance company." And so it enabled them to negotiate with their doctor for the very first time. Now, the great thing about this, doctors will tell you, and I still have doctors to this day say, "Oh, but my contracts with the BUCA plans don't let me do that." If you look at those contracts, and I make everybody pull out their contracts, if you look at them, they say, "Except where excluded by law." And this is the law to which this refers. This is the HIPAA omnibus rule. And it really does protect consumers. So it enables a patient to come to me even if the imaging center may be in network with Blue Cross Blue Shield, a patient with a Blue Cross Blue Shield card can come to me, get self-pay pricing at that same facility. And that facility cannot submit that insurance claim. They cannot submit that information to the insurance company. And so it's one of the things that, yes, it's a regulation, but it's something that enables us, if you educate yourself about these things and read the fine print, these are things that can be protective and really enable your business model to flourish. Qualified, and then we look at the regulations that surround ERISA plans. These are employer-sponsored health plans. These are important as well. Qualified high deductible health plans were kind of a bugaboo for us in the beginning. We couldn't figure out how we work with these, health plans that they have an HSA in front of them. They're highly regulated. The employees have to have to get to their deductible before the employer can kick more money in. But when you start looking at the subtleties of these, this actually works well with green imaging, because what these patients have is they've got money on a card that they can spend, for the exam. They've got it right there. They can pay for the study. They're not having to pull it together, wait till payday, like a lot of our patients have to do. And it benefits both the employee and the employer, because the employee is going to pay $400 instead of $4,000 for this imaging exam. So they're going to have a lot of money left over to pay for other care. They're not getting near that $4,000 would probably make them hit their deductible. $6,000 they would hit their maximum out of pocket. And then everything is on the employer beyond that one imaging exam frequently. That one imaging exam can take them to their maximum out of pocket. And so if that doesn't happen, if it's a $400 MRI, then the employer's benefiting. This employee is going to, have much more money to spend on that HSA. So that works really well for us. And then when I was preparing for this week, I was actually going back to the regulations, going back to the statutes. And, I had never seen this, but it's actually that an employer cannot put money to an in-network provider. We're not in network with the BUCAs. And so actually, if an employer wants to pay first dollar, go ahead and do zero out of pocket like they are for their other employees who are not on the qualified high deductible healthcare plan. They can do that because we're not in network. So that was really, just once again, the more familiar you are with the regulations, the better you're able to craft your business around them. Fiduciary duty is another really important thing that I find, as a doctor working in this, kind of emerging healthcare market with ERISA plans, is that, employers assume frequently when they have a BUCA plan or a traditional healthcare plan in place that healthcare plan is taking care of their fiduciary duty. And that's absolutely wrong. The employer is the person with the fiduciary duty. Just like they pay attention to that 401k or many other components of their benefit plan, they have the fiduciary duty to make sure that these employees' dollars are well spent. And when you've got a, $1,600 MRI at Methodist Hospital in Houston, or you can go to Green Imaging and get a $375 MRI, I think not having, a lower cost option in your healthcare plan is you're abdicating your fiduciary duty to your employees. And this is a perfect example of this. This is a school district in Florida that is one of the least wealthy school districts in the state. And these employees in 2019 had their entire wage increase wiped out by the increase in their Cigna premium. And the teachers union went to the school board and said, these people are spending 20% of their income on this health plan and they can't afford care. They've got this $4,000 deductible, $6,000 maximum out of pocket. They can't afford this. Nobody's getting the care they need. And so the school board did two things. And Carl Schuessler, who I don't see in here, but, brought us in on this and was really, they were stuck with Cigna for another year. There wasn't anything he could do about that. But the two things that they did is, number one, they moved the near-site clinic away from a big hospital system there where we know the cost of care throughout the episode of care is going to be 4 times greater. And they moved it over to the Rosen Health Center at zero out of pocket for the employees. That was step one. And step two was they put in green imaging, because one of the things we looked at, we did the claims data analysis. And if you look at this, their average MRI was $1,400. Average CT was $2,000 in that health plan. X-ray $200 and mammo $300. And so we looked at, we had a network in that area that had just kind of happened along the way. We didn't have a large number of lives. And so we put our pricing up against it. And we predicted 1.3 million in savings in 2020. And so, we launched with them. It took about 3 months to really ramp up, get a good volume going. And then the pandemic hit. And so, in 2020, we were, at 50% capacity for several months. Florida was hard hit. But we were able to actually get our pricing down. We leveraged the 10,000 lives, and actually we had the Rosen Health Center. They loved our customer service. They came on as well. That was another 5,000 lives. We started leveraging those lives, and we got our pricing over here in the actual. We got our pricing down about 20% for these employees and for the school district. And then so in 2020, despite the pandemic, we were able to save the school district and the employees $1.5 million. We just got the trailing 12 months numbers in for the last 12 months, and we're at 2.3 million for the last 12 months. So this is an example of this school district took on its fiduciary duty. They saw it wasn't working, and it wasn't working for their employees, and they changed something. And now they're with an independent TPA. There's been upheaval there, but they've saved millions and millions and millions of dollars, both out of the employees' pockets and out of the school district. And one of the things we talk about, the price of gas. Everybody kind of keeps an eye on the price of gas. People keep an eye on the price of an MRI. Everybody asks me what my MRI prices are. CT scans were actually, while nobody was watching, escalating. And in health plans, they're higher. I'm seeing that across the board in the claims data. They're actually more expensive than MRIs. They're not more expensive from a technologic standpoint. They're just able to raise the pricing because nobody's looking. And so we were able to save the district 80% on their CT scans. But like Dr. Bylund said, it's the customer experience that ultimately matters. We were not first to market. One Call is a company that's it's been bought by the KISS card at this point. They went into receivership, or at least this part of their business went to receivership. We weren't first to market on this. I think, we have a very different take than One Call did. They were a traditional network. We consider ourselves what we do direct care. We are owned and operated by radiologists. We're in there looking at the patient's orders, making sure they're getting the right studies, clarifying things. If a doctor has a question, we're there. If there's ever a question of quality, we have peer review access to the images and reports. We're still reading more than half of the studies done in our network. We're hands-on. And I think that's a big differentiator. And I think technology has evolved as well. I think, one phone call, the joke was they weren't one call, they were 5 calls. And now, I think technology has, we have a referral platform where we're communicating both with patients, referring, clinics, and with the imaging centers we're working with, all on this one platform. Technology has enabled us to do this. We went from, our old tagline was the same high quality medical imaging at a fraction of the price. Now it's easy, affordable medical imaging. It's not easy from our standpoint, but it is, from the patient standpoint, our goal is to make it really easy for patients. And if you look at one of the other things we discovered along the way was, we did this apps 5 years ago when apps were the hot thing, so patients could self-schedule. We had 30% error rates in patient self-scheduling. And that is multifactorial. Patients always think contrast is better. And better than just contrast is with and without contrast, which is, even more radiation and exposure. And, so along the way, we learned that was not a good model, that patients really need, especially when they're in healthcare risk, patients need handholding. And so our concierge is really the most important piece of what we do at this point in time. That's the key to the patient experience, whether they're texting with the concierge or talking to them on the phone or emailing or however they choose to approach us. But if you notice in our Google reviews that our concierge are almost always called out by name, and we take great pride in that. And our net provider score is world-class at 77.5. And then the other factor here is not just regulations, it's market forces. And, the thing that has just been fascinating to me, I knew it was going to happen, and I've been throwing it out there as a, prediction in my talks. But what has happened really, we were at 50% capacity in imaging for part of 2020. Still, we're at about 80% capacity. Imaging centers weren't getting independent centers weren't getting great reimbursement to start out with. Costs have gone up. The price of helium has doubled. And so mergers and acquisitions in this space have just been rampant during the pandemic. And so both in the professional services space with radiology groups and in the independent center space. And so, Simon Med just sold for $2 billion. We have Reyes consolidating the market. We have Acumen consolidating the market. But most of those entities are willing to work with us because we've got a national presence and we bring them patients, and, they typically have very honed workflows. So, that isn't such a problem. Where the big problem is that's driving up what I see the cost of imaging is in the radiologist. It's in my field. And so there are radiology supergroups now. There's one in North Carolina that is 1,400 radiologists. Over 100 practices have been pulled together. And what they do is they go look at all those 100 contracts for Blue Cross Blue Shield, and they pick out the best one, what they consider the best contract, the one with the highest reimbursement. And they're all billing under that now, under the same tax ID. And so, I've predicted that was going to drive up the cost of care, but I saw it in numbers this week. Let's see if we can get to that. This was some Blue Cross Blue Shield data of a potential client. And two and a half years ago, my contracts were in the 18 to 20% range for interpretations for the professional services. So 18 to 20% of the entire expense for medical imaging. This is their entire expense for medical imaging, almost $1 million. And look at that, 43% of it is professional services now. So that hasn't, that's not something that it's taken away from the cost of the scan. That's just added to the cost of imaging. So that's an increase in 23% in imaging costs, which when it is happening with split billing, which is when the radiology group is billing for one piece of the service and the imaging centers or hospitals are billing for the other. And that's about 70% of imaging. So that's gone up by 23% over the pandemic. And then, reference-based pricing. I understand reference-based pricing. I understand the need for it. I do think it probably works for some practices. It's a bad reference. I think when you're looking at a reference, is it a valid reference? For imaging, imaging has taken 10% cuts for Medicare 2 years in a row, not because costs have gone down. Everybody knows costs have gone up. Cost of labor has gone up. Cost of helium has gone up. We have to disinfect. We have to do all these things. But because E&M expenses, or E&M payments are going up so they can pay the those doctors who deserve increased reimbursement. But Medicare has to balance things. It has to have a balanced budget. So they just keep taking from radiology. So we are down to $235 for an MRI of the joints and spine in Houston, Texas now. That's global. That's the scan and the radiologist. And that's not sustainable. And so it's a broken reference for us. One of the other, is it market-based? No, there's very little geographic variability. The only real variability in Medicare pricing is that an outpatient imaging center is paid versus a hospital. And that can be a 5 times differential on an x-ray. So that gets to another, which Medicare fee schedule? Because I can work all day long on a Medicare fee schedule that's hospital-based, and they're really the competition. What we're doing is pulling patients out of these hospital systems where 70% to 90% of imaging happens in communities and getting them to outpatient imaging centers. Is it adjustable for increased costs and inflation? No, absolutely not. Is it a reasonable starting point for a pricing discussion? Yeah. And I think that's what, I've talked to Jay this week. I've talked to Dave Chase about this. And I really, I understand that. It's just a starting point. Is it a valid starting point for what I do? It's not, but you know what? We're the best answer in imaging. Okay. If it's not a good answer, let's direct contract. That's kind of how we're working with reference-based pricing. I think one of the things that's really important is that we've thought for decades now that, healthcare needed this huge reform, this huge overall change. And I think what I've seen happen over the 10 years I've been doing this is that incremental change is the best. We are changing things a little bit at a time. We're making things more available for self-pay patients. The health sharing ministries are booming. Employers are starting to put solutions in place that take care of parts of the problem and fix part of the problem. And, we've, just like we were with School District of Osceola County, we're a great step in that direction. People say, how do you work with a fully funded plan? I said, we work great. Look at this. The employees can't, they've got this high deductible. They can't afford imaging. Let's get them imaged so we can take care of the problem. And the employer's not going to have this huge expense, catastrophic expense 3 years from now when this patient gets diagnosed. So take care of the problem, pull all of that out of the Blue Cross Blue Shield pot. These are not going to show up next year, and hopefully your premiums will be less. And it's a great first step because they can see the savings. This is what you would have paid for this in your Blue Cross Blue Shield plan. This is what you paid with brain imaging. We can do this across the board for you. Let's get you out of here. And so that's kind of, my message. One of the really cool things that's happened though, and this has been over the last 2 years that we've seen. We've been doing this a long time. It's, we're constantly trying to hone our model, make things better for our patients. And the thing that has really made it better for the patients has been the growth, getting enough lives under our belt that we can leverage pricing, number one, and that we can leverage great customer service. We've become the best referral source for a lot of these imaging centers, especially in Texas and Florida. And you know what? Orlando Diagnostic Center opens on Saturdays and Sundays now for the school district employees to get their exams. And that is a win-win-win. And that's to me the future of healthcare. If we can do this right, if we can keep, and I also think it's still community healthcare. The people I read the mammograms for School District of Osceola County. I'm in there, talking to those patients, talking to them about what the best next step is. Even though I'm in Texas, I can do that. Technology is enabling us to provide community care from a distance, and it's a really cool thing. So thank you very much for having me today.
We have time for a few questions. So since we're live streaming, we want to make sure before you start asking your question, make sure you have the microphone. I'll pass it around. So we'll start. Dr. Talley.
Thank you. Dr. Dickerson, are you licensed in different states around the country? And then how many radiologists do you work with directly? And how did you go from just you to a national company?
Well, it was really interesting because we started with just 2 radiologists. And when we started doing green imaging and taking patients to these imaging centers, most of the time radiologists are sitting in the back room reading studies. They're not bringing patients to an imaging center. And when we did that, our radiology group grew exponentially. It grew much faster. It actually slowed the growth of green imaging. And so we really, we had, I think, at the most 6 full-time radiologists. And, we have to have multiple subspecialties. And what ultimately happened is we had to pare that radiology piece back to really focus on, getting the operations and getting into employer health care plans. I am licensed in 4 states. Each of my radiologists has a different combination of states that they're licensed in. And we have a number of independent contractors that we work with who, have coverage in different states. We have to have at least a combination of if we're going to read the studies in that state, we have to have a combination of a neuroradiologist, a musculoskeletal radiologist. Most of us are oncologic radiologists. Almost all of my radiologists trained at MD Anderson. But, all in all, probably we have 10 independent, contractors doing the radiology piece. 3 of us do it full time. And so, I'm the general radiologist with an oncology background. We have Dr. Kirk, who is a past president of the Texas Radiological Society, who's our neuroradiologist. And we have Dr. Cook, who is an Ironman trained musculoskeletal radiologist. So the 3 of us are the primary, but we have lots of help along the way. And, we still do have imaging centers that read their own studies. We have to have that, in this model to be able to do it. But we have peer review access to the images and reports contractually, so that if there's ever a question of quality, we can get in there. And that's the advantage, as of being a physician. We can dig in there. Whereas if we were just a traditional network, that wouldn't be able to happen. Thanks. Good question.
You made a really critical statement when you said patients don't know, they can't order, they don't understand medicine. And it's much like the other professor said, we're unaware of what's available. So I'm really interested in your concierge service and how that concierge works and helps that patient understand, this is what I think you need, this is how we direct you into the right care.
Right. The concierge is front line, but, we have radiologists who are also on that platform. So, we're actively involved in making sure that the patient gets the right exam. It's just like a patient who comes to us and says they need a screening mammogram, but they're having left breast pain. That patient needs a diagnostic mammogram and an ultrasound. And so it happens lots of ways. Sometimes a doctor gives a patient an order and the patient goes out and shops for care. Most of the time, it's in a hospital system and they get sent down the hall. And that's the most expensive place to get an MRI is down the hall at the hospital system. We get faxed orders. We have doctors who know us and trust us and know that we're going to do the right thing for their patient who just send the orders across to us. We have patients who are shopping. We have a great, and so they text us or web chat with us, or, we do have a secure messaging platform where we can just communicate with patients. We ask screening questions. Do you have any metal in your body? Have you had prior surgeries on this area? We really, the ease of communication, and that's one of the things that I think we have as an advantage that probably One Call didn't have 10 years ago, is easier communication. Now, patients may or may not respond after the 3rd text. Some of that is a little, but we really pride ourselves on communication. We try to meet the patient where they came in. If they email us, we try to communicate that way. Patients have even generational, and boy, we've got a generation that wants to talk on the phone. And during the pandemic, our phone call average actually went up 5 minutes because people just needed somebody to talk to. And, we always want to have that live person. I think we're at 85% of, we pick up the phone the first time, but they get a call back if we're not available to do that. We feel like that human touch is essential. Even if it is electronic, it has to be a real person that they're dealing with and not a bot in healthcare.
Let me just add to that, because there was one core word that you used over and over again: communication. Right? So even if you're starting something new, you have to communicate to your audience, the potential customer, what it is you're offering. And in medicine, traditionally, the patient has no freaking clue. Right? So it's your job to tell the patient what they might need and why they might need it. Why is it so valuable? That type of communication is core to healthcare entrepreneurship.
Really dovetails into my question. Great presentation. Thank you very, very much, both of you. For Dr. Bylund, you mentioned that not only providing superior value, but really making sure the consumer understands and agrees with that superior value is just as critical. I couldn't agree more. How do you see that articulation failing many times? Are there patterns you recognize that are, endemic to that failure?
Oh, good question. I mean, I think in healthcare, there's not a whole lot of communication to begin with at all. So that is the big problem. And you don't actually talk with your doctor. You don't actually communicate with the provider, but you go through your insurance company just hands you over to someone pretty much. They do the payment systems. Your employer subsidize the insurance and so forth. So you're not actually involved until you get sick, right? And at that point, you don't know anything. But you have a physician, and that's the figure of authority, the figure of expertise, and that person can tell you what you need, and you go, okay, whatever. And usually when you enter a physician's office, you're going to exit with like 3 prescriptions at least, and then you go to the pharmacy, and then you just put pills in your mouth. But what actually happens? You don't really know, right? So we have an uninformed consumer class in healthcare, and it's exactly the same thing in higher ed. I mean, why do people get a degree? Well, other people are getting degrees, or my employer probably needs one. Well, why? It's 4 years of really expensive partying to get a stamp of approval, to get a diploma, right? That's not really what college is supposed to be about. And healthcare is suffering from the same type of problem, right? And how do you solve that? I mean, that's the magic of entrepreneurs, right? I can only tell you the problem. I can't tell you how to solve it, because then I would do it myself.
Another question that came in online, Dr. Bylund. In light of the history that a lot of people perceive, at least, that there have been a lot of consumer fraud and hucksters out there, is there some metric to determine whether or not a regulation is in fact beneficial, or how would you respond to that?
That's a very good question, because it's a really hard question. So I'm not sure how to answer that. I mean, I think the harshest regulator there is the consumer, right? Because if you screw over one consumer, you're probably out of business, unless you're in a protected business, right? So if you are an incumbent in an industry that is highly regulated, you're not going to be replaced. And if consumers hate you, they might go to one of your competitors if you have one. But there's not going to be a new entrant, a new entrepreneur saying, I'll do this in a different way. I'll serve consumers. So you don't stand to lose a whole lot. In an actual free market, if you screw over consumers, well, you might do it once, and then you're gone. You can't even start a new business because reputation, right? And that consumer who was screwed over will probably find it beneficial and have an interest in telling everybody else that, this guy, that's a snake's oil salesman, right? Whether true or not, right? So you have to treat your customers well. Even if you treat them the right way, or give them what you think they need, but you don't communicate it, it might still be the end of your business, right? So it's still in the mind of consumers. But as for measuring a regulation, the problem is that the cost is long-term. It's the unrealized, right? And you can't really measure that. You can't measure what didn't happen. And that value that didn't happen, that's the biggest loss of any restriction. We can just say that it's huge. How huge? I have no idea.
Dr. Lantier?
Hi, I'm Steve Lantier, so co-founder of the Surge Center of Oklahoma with Dr. Smith. Just want to make a quick comment. What you were talking about, the smallness and morphing, kind of what happened as time went on. So with Keith and I, the same thing. When we met Jay Kempton, Jay needed surgery care. And of course, we had those prices listed. So the transparency was obviously there. But what happened is then Jay said, well, now I have surgery listed, but now I need big spine. Now I need cardiac. Now I need imaging. And so we helped put Jay in contact with all of those people. And then what happened is the Surgery Center of Oklahoma started becoming this reference source. So people would call us and say, well, where can I get all these different services? So just watching and seeing the need develop, just like you're a referral source now, that's what actually happened with us. And I thought that was a great point. So just kind of being aware of the market and what keeps happening. So,
hey, thank you guys for the time. Dr. Dickerson, I'm curious, you were talking about how employers can sponsor cash price-based products if it's out of network. Do you find employers, especially self-insured ones, generally understanding of the sort of economic reality that they can save a couple grand on MRIs, for example, by still sponsoring that for an employee if they go to a cash price provider?
Absolutely. There's tremendous savings for, for the employer and the employee. And I think, we actually, we have an employer that it's actually another medical provider that during the pandemic, went to zero, waived the copay and just went to zero out of pocket with green imaging. That was Axiom Medical. Yes, we're, our volumes haven't increased because people are still not getting that pent up demand for imaging, but we've more than doubled our covered lives in the last year and a half. And that continues to increase. The value is there. I think their employers are at a tremendous stress point. They need to be able to offer more and more for their employees. This is definitely, a tough market to hire. And I think, it's not enough to just have a health plan anymore. I think you need to have some extra perks in there that really help people get care. And I think that's the next wave, is getting those zero out of pocket options in place.
My question revolves around, you talk about the education of consumers. How much and what frustrations have you had educating the medical community and navigating around that? How did you get over some of the resistance and that within your own medical community?
We built green imaging in Houston because we had 21% uninsured. We built it as a low cost self-pay network first. I had been a self-funded employer when I was president of medical clinic, diagnostic clinic of Houston. We had a self-funded healthcare plan. We incentivized our employees to use low cost care. But really we were a, low cost option. And so doctors who are independent in Houston have used us for years. That's a great referral source. The hospitals have reluctantly come along. Actually, we get quite a few referrals from Methodist Orthopedics now, directly from their scheduling for people who can't afford their exams. And so more and more we're seeing that happen. Kelsey-Seybold, their own employees, were on their health plan and they were subject to hospital rates in their own facility. And so we started from there. Their imaging people found out about us, and when their employees couldn't afford the care, they started sending it our way. MD Anderson used to tell patients that if they went outside for imaging, they were going to lose their patient number. It was that bad. I have received some referrals, direct referrals with a letter of reference from the referring physician now coming from MD Anderson to us because the patient was quote unquote indigent and could not, afford the care there. So we're, it's a transition. I think the hardest thing is for these doctors who are incentivized by their hospital system. 70% of doctors are subsidized by or get paid by the hospital systems. And the volume of ancillary services they, provide is part of that, how they get paid. And, we do see as, patients have this zero out of pocket option, a patient who's at Methodist Hospital, they have a zero out of pocket option for green imaging. They get sold a bill of goods that we've got something better down the hall, that I need to be able to look at it on my PAC system. We have a very efficient way of sending out images. We can actually email the images. a CD can be burned from it. It can be loaded into a PAC system. You know, we just have to continue to actually educate the employees that, you know, this is a viable option. You don't have to go where your referring physician sends you. But I see referring physicians being understanding now. I think they're starting to see that patients can't afford it. It's been a slow change. I mean, this is a decade that we've been doing this. But yes, I see more of the hospital physicians starting to understand that patients can't afford care in their system.
Thanks again, Dr. Dickerson, Dr. Bylund, for your great presentation.